This presentation is going to be on nutritional supplements and some complementary therapies. First, we'll talk about vitamins. In terms of vitamins and supplementations, first we have to realize that there are some dietary reference intakes that will help us to establish if our patient needs supplementation or not. The first one is the recommended dietary allowances, or the RDAs, for vitamins, and they're set by the Food and Nutrition Board of the National Academy of Sciences. And what RDAs do is they represent the average daily dietary intake that is sufficient to meet what is required of a healthy individual. And this is going to be true for about 97 to 98% of healthy individuals. And these figures aren't absolutes, they're just, again, recommended. And these can change as people grow older, and they will differ whether you're a male or a female. Typically, it will increase for a woman that is pregnant or breastfeeding. And we know that RDAs only apply to individuals that are in good health. So I just want to make sure that I reiterate that, because when we are working with patients that are not in good health, these RDA values will change. Now, the concept to re-familiarize ourselves with is the acceptable macronutrient distribution range, or the AMDR. And this is a range that allows us to understand the proteins, the carbs, and fats, which are our macronutrients, and how much we need, and its association to optimal health. Now, the intake of the nutrients that are established, the ranges are presented in the slide, and you want to see that the intake of nutrients above the established ranges may need to happen if you are working with the patient with chronic illness. So those macronutrient levels will increase. Vitamins can be classified into two different subcategories. We have fat-soluble vitamins, which are our vitamins A, D, E, and K. We have our water-soluble vitamins, which are vitamin C, and those that are within the vitamin B complex. Now, with the exception of vitamin B12, we don't really have the ability to store extra water-soluble vitamins in our body. What this means is that we need to frequently eat the foods that are rich in vitamin C and B complexes to replenish the supply. In contrast, with our fat-soluble vitamins, we actually have the ability to store vitamins in reserve in our body. Now, this can be a good thing, but it can also be a bad thing. It's good because we have minimal risk of deficiency of A, D, E, and K. However, it does put you at risk for potential toxicity, especially with someone that is taking on vitamin supplementations of fat-soluble vitamins, in addition to eating foods rich in vitamins A, D, E, and K. So please consider this before prescribing or recommending any vitamin supplementation. With the water-soluble vitamins, consisting again of vitamin C and the vitamin B complexes, we know that the vitamin B vitamins, they really differ from any other structure and function of vitamins. They're grouped together because they were first isolated by the same source, and that source was yeast and liver. That's how they all came about and got grouped together. But vitamin C isn't found in the same foods as vitamin B, and so therefore it got classified all by itself. With the vitamin B vitamins, they're known by their names. And as a general rule, they have a number name, but also they have a long scientific name, like vitamin B6. That's pyridoxine. Vitamin B12, which we know is cyanocobalamin. Vitamin numbers are used more often, and this is what we can refer them to, but you can also use the longer names. There are two compounds. They're either pangamic acid or laetrile. They have been falsely promoted as B vitamins, but pangamic acid has been marketed as vitamin B15 and laetrile as vitamin B17, but there's no proof that these compounds act the same way as the other vitamins lumped in this vitamin B complex group, or that they even act as vitamins at all or play any role in human nutrition. So be aware of things that are marketed as B15 and B17. With ascorbic acid, or vitamin C, it participates in multiple biochemical reactions. We know that among these things is the synthesis of adrenal steroids. It also helps with the conversion of folic acid to fulonic acid, and it helps with the regulation of our respiratory cycle in the mitochondria. But now at a tissue level, vitamin C is required in the production of collagen, and this is why we see a lot of vitamin C in facial products, because we're trying to promote collagen for younger looking skin. Vitamin C is also required for other compounds that comprise this intercellular matrix and bind cells together. Additionally, vitamin C facilitates the absorption of dietary iron, and many times we will promote this as we're prescribing iron for iron deficiency anemia. The only established indication, though, for vitamin C is the prevention and treatment of scurvy. For severe acute deficiency, so for severe scurvy, we need parenteral administration, which is recommended. It has been advocated for therapies of other conditions unrelated to scurvy, like cancers, asthma, osteoporosis, and even you've probably been recommended to take vitamin C when you have a cold. However, the claims of efficacy for these conditions have been disproved. There have been other claims that remain unproved for right now, and there still needs to be more science to back it up. Now, what I would say is it doesn't hurt if someone takes a vitamin C supplement, as long as they are not taking too much, because remember, you don't want to take something that you don't need or pay for something that you don't need. But in theory, our body can't reserve or preserve vitamin C in our body, so there's no risk really for an overdose or toxicity. I remember that this doesn't happen with our water soluble vitamins. Research has also failed to show any benefit of vitamin C for patients with cancer, atherosclerosis, or schizophrenia. And these are other things that you might have heard in talking in healthcare, but there is not enough research yet. Vitamin C does not promote wound healing as well, unless there's also a severe deficiency that underlies. So understanding that the only thing that it is indicated for is the prevention and treatment of scurvy, unless you're going to use it in serum form on your face. The main dietary sources of ascorbic acid or vitamin C are the citric fruits, juices, tomatoes, potatoes, strawberries, melon, spinach, and broccoli. And orange juice and lemon juice are especially going to be those things that have a mass amount of vitamin C. Okay, so let's talk about scurvy for just a second, just to remind ourselves what that is, and if it's relevant in the U.S. at all. It really is rarely seen in the U.S. because we have so many foods, and we actually supplement other foods with vitamin C. But if you do have a patient with scurvy, their symptoms would include faulty bone and tooth development. Their teeth would be really loose. They'd have gingivitis, bleeding gums, or just poor wound healing in general. And this is when you would, attribute the accelerated wound healing with vitamin C supplementation, is because it's an underlying symptom of scurvy. You might even see hemorrhage into muscles and joints that have ecchymosis over some of their tissues around their body and their skin. Now, many of these symptoms result from the disruption of that intracellular matrix of capillaries and other tissues. So I want to go back and just remind you of what it does again. at the tissue level, vitamin C is required for that production of collagen and the compounds that comprise the intercellular matrix. So that is the connection with scurvy and the symptoms that you're going to see. Now, not a common cause of deficiency, yet we should still talk about this. Smoking does create an increased need for vitamin C. So for those that are smoking excessively, the recommended level is to increase your vitamin C intake by 35 milligrams every single day. Okay, let's say we do get into a situation where somehow someone takes too much vitamin C. These excessive doses can cause nausea, abdominal cramps, diarrhea. The mechanism is directly irritating the intestinal mucosa, and in order to protect against GI disturbances, you really only want to recommend about 2 grams per day for an adult. So it's not going to kill you, but you will have some GI discomfort. Vitamin C is available in oral and parenteral administrations. Again, you're rarely going to give parenteral administration unless they have severe scurvy. Oral products include tablets. We also have time-release capsules, syrups, granules, crystals, powders. Really, it comes in all types of things. Wafers, effervescent powders. And it may be administered parenterally by sub-Q, IM, or IV routes. Now let's talk specifically about the other vitamins that are in the B complex. We'll first talk about vitamin B1, which is thiamine. And in its active form, thiamine is an essential coenzyme for carbohydrate metabolism. And the requirements are related to the caloric intake and are greatest when our carbs are the primary source of calories. So sometimes what we will find is those individuals that are eating a lot of carbs, and that's the majority of their diet, they're going to need more thiamine than other individuals. The only indication for thiamine or prescribing thiamine is treating a thiamine deficiency. So you want to ask yourself, what are these times where we might have a thiamine deficiency? And I'll let you think about that for a little bit. We know that in the US, the principal dietary source of thiamine are our enriched, fortified, and our whole grain food products, especially breads and the cereals that are like on the shelf ready to eat. The richest sources of natural vitamin are fish, especially tuna, salmon, anchovies, and then we also have liver. Now, secondary to those things, chicken, pork, beef, and lamb are also good sources of thiamine. So let's go back and think about thiamine deficiency. Severe thiamine deficiency will produce beriberi, and this is a disorder that has 2 distinct forms. We have wet and dry beriberi. The wet is so named because its primary symptom is accumulation of fluid in the legs. Cardiovascular complications like palpitations, changes in EKG, so arrhythmias, and high output heart failure are common and may progress rapidly from a circulatory collapse and then death. Dry beriberi is characterized by neuro and motor deficits. So you might feel anesthesia at the feet, ataxic gait, you might see foot drop and wrist drop. Edema and cardiovascular symptoms are also not going to be seen in the dry type of beriberi, only in the wet type. In terms of response, wet beriberi responds rapidly and dramatically to replacement therapy. With dry beriberi, the therapy can be very slow. Again, that is the type of disease that will most be seen with neuro and motor deficits. However, thiamine deficiency in the US, hopefully you were able to get to this part yourself, It's more commonly among people with chronic alcohol consumption because we've already talked about alcohol misuse. Now, in this population, the deficiency of thiamine will manifest itself into Wernicke-Korsakoff syndrome. Sometimes this is called Frank beriberi. It's a serious disorder of the central nervous system, or the CNS, and we'll see both neurodeficiencies and psychologic manifestations as well. So some things you might notice are nystagmus, diplopia or double vision, ataxia, and you start to lose some of your recent memory. If you don't correct this thiamine deficiency, you may have irreversible brain damage, and that's the number one thing that is of worry. Now, if you have someone that you are suspecting has Wernicke-Korsakoff syndrome, parenteral thiamine has to be administered immediately, and this is not going to be done in an outpatient setting. You're going to send them into the emergency department for this because of the neuropsychotic manifestations. However, for some less severe thiamine deficiencies, you can take thiamine orally, and really it doesn't have many adverse effects that you need to worry about, as long as you are, following the daily recommendations. Thiamine is available in standard tablets for PO administration, and we have solutions for both IM and IV. So for mild deficiency, use the oral thiamine. If you think that someone is experiencing wet or dry beriberi or the Frank beriberi, which is Wernicke-Korsakoff syndrome, you would order IM or IV administration. Moving on to vitamin B2, riboflavin. This participates in numerous enzymatic reactions in your body, but to do this, the vitamin has to be converted first into two active forms. We have to turn riboflavin or vitamin B12 into flavin adenine dinucleotide or FAD, or we need it to turn into flavin mononucleotide or FMN. And then both of these forms, FAD or FMN, riboflavin is going to act as the coenzyme for the multiple oxidative reactions that occur in your body. It's also indicated for the prevention and the correction of riboflavin deficiency, which occurs with other types of deficiencies alongside other B vitamin deficiencies. And early on, when you have riboflavin deficiency, you might have a sore throat, you might have angular stomatitis, which are those cracks in the skin at the corners of your mouth. Later symptoms or worsening symptoms are cheilosis, which is the cracks in the lips, glossitis or inflammation of the tongue. You might even see vascularization of your cornea. Your skin becomes very itchy, and you might have itchy dermatitis of the scrotum and vulva. Now, oral riboflavin is used for treatment of these things. In the US, where do we get most of our riboflavin? It comes from milk, yogurt, cheese, bread products, and fortified cereals. And we can also find riboflavin in organ meats and other protein sources like that. In terms of toxicity, we don't really see this in humans, but when large doses are administered, the excess is going to be rapidly just excreted into the urine. So we haven't seen any harm really. We have seen some studies that show that riboflavin can help prevent migraines, but the prophylactic effects do not develop until you've been taking riboflavin for about 3 months or more. If you are going to prescribe a prophylactic dose, it's usually 400 milligrams, which is much, much higher than the recommended daily allowance. You are giving riboflavin orally, and it comes in both capsules and tablet form. Vitamin B, which is vitamin B3 or niacin. We also know it as nicotinic acid. It may sound very familiar because we talked about it when we went over the drugs that reduce cholesterol, although we don't really use it it's not as favorable as maybe a statin. But if someone can't use a statin or doesn't respond well to a statin, it is something that you might consider, but you're going to use higher doses than just for someone that has a dietary deficiency of niacin. So it's both a vitamin and a medicine. But even before niacin can exert physiologic effects in your body, it has to be converted into nicotinamide adenine dinucleotide, or NAD, or nicotinamide adenine dinucleotide phosphate, or NADP. Both of these are coenzymes in the oxidation reduction reactions that are essential for cellular respiration. As a vitamin, nicotinic acid is indicated for the prevention or treatment of niacin deficiency, but we can also use it off-label for other things like pellagra. So where do we get our nicotinic acid? It's present in foods of plant sources and animal sources, particularly in liver, poultry, fish, potatoes, peanuts, cereal, and cereal germ. In humans, the amino acid tryptophan can be converted into a nicotinic acid. Remember, tryptophan is something that you can find in turkey. Hence, proteins can be a source of vitamin. About 60 milligrams of dietary tryptophan is required to produce just 1 milligram of nicotinic acid. Now, you probably were wondering, what did she say? Pellagra. Well, this is a syndrome caused by a niacin deficiency. And the term has to do with two Italian words, pelle and agra, meaning rough skin. Now, by its name, you can understand what some of the symptoms might be. Dermatitis, so you might have scaling and crackling of the skin in areas that are going to be exposed to sun. Other things that you might see in your patient or that they may complain about with pellagra is abdominal pain, diarrhea, and they'll have soreness of the tongue and the mouth. In terms of central nervous symptoms, you'll see irritability, insomnia, memory loss, anxiety, and dementia. But they can be reversed with niacin replacement therapy. In terms of toxicity, it has a very low toxic profile, and in small doses, you really don't even have any adverse effects. But it's when you take large doses that you can cause vasodilation, flushing, dizziness, and nausea because of the vasodilation. Remembering that it can be used as a medicine as well. Now, when you have flushing, we can actually use this as an index of excess niacin consumption. So it could be the symptom that really lets us know that there is toxic levels in the body. The Food and Nutrition Board has set 50 milligrams as the adult limit. In terms of using this compound, it can actually be a substitute for nicotinic acid in the treatment of pellagra. And the compound that I'm talking about is nicotinamide. And in this form, it's not a vasodilator, and it doesn't produce the adverse effects associated with the large doses of nicotinic acid. So again, you can convert and use nicotinamide instead of nicotinic acid. The only administration of niacin is orally, and it is available in immediate release and extended release. You can also use powder form, but all of these availabilities are only for oral administration. B5 or pantothenic acid is rarely prescribed. It can be taken as a supplement. It is found over the counter, but there's no therapeutic use for using this supplement unless you have a deficiency of pantothenic kinase, which is associated to a neurodegeneration 2 mutation, which is a rare genetic disorder. And unless you have this genetic disorder, you wouldn't need to replace a pantothenic acid. Now, pantothenic acid kinase is a main enzyme in the metabolic pathway responsible for coenzyme A synthesis. And additionally, we need it for the A cell carrier protein as well. Now, the A cell carrier protein is required for the synthesis of fatty acids. However, majorly, it's the coenzyme A that really is affected. It's an essential factor in multiple biochemical processes. We need coenzyme A for gluconeogenesis, and it also is an intermediary of metabolism for carbohydrates, and we need it for the biosynthesis of steroid hormones, porphyrins, and acetylcholine. There are no reports of toxicity from pantothenic acid, and there's no upper limit then that has been set. It is found in a single ingredient tablet, but it can also be found in multivitamin preparations as well. But remember, really there is not a need unless you have that rare genetic condition. Or vitamin B7 is an essential cofactor for several reactions that have to do with metabolizing carbs and fats. And the primary reason someone would need an over-the-counter biotin is to treat hair loss or to improve skin condition. And you probably see this in large amounts at Costco or Target. It's prescribed to treat biotinase deficiency as well, which is a rare inherited disorder. This vitamin, biotin, is found in wide varieties of foods, and the exact amount in most foods hasn't really been determined, but we know that we do need it in our body and in our diet. Additionally, being available in foods, biotin is synthesized by intestinal bacteria. Let's go back to biotin deficiency for a minute. It is extremely rare. In fact, to determine the effects of deficiency, scientists actually have to induce it experimentally. And when they do this, subjects experience dermatitis, conjunctivitis, hair loss, muscle pain, peripheral paresthesia, and psychological effects like lethargy, hallucinations, and depression. As far as toxicity goes, it really is devoid of toxicity, and when subjects were given large doses, they didn't have any adverse effects. So no upper limit has been set for this vitamin as well. Now, although it doesn't cause adverse effects, if you take it in excess, it could result in some things that they found in the lab. And what they found is that in their lab studies, only one death occurred, and this is out of a 2017 study, and a warning from the FDA that was issued in that year. Biotin is available in a tablet and a capsule form for oral dosing, and again, the major use is for hair loss and to improve skin. Folic acid, and this should be familiar to you because we talked about it when we were discussing the megaloblastic anemias. Vitamin B9 occurs in two forms, and sometimes we use this term interchangeably, or these terms interchangeably, but they really are different: folate and folic acid. With folic acid, this is the synthetic form, but it's actually more stable than folate. And in the presence of food, actually the bioavailability of synthetic folic acid is at least 85%, which is better than the bioavailability of folate, which is 50%. Folate itself is a coenzyme in the synthesis of nucleic acids like DNA and RNA, and we also need it to metabolize amino acids. In terms of therapeutic uses, we will supplement to prevent neural tube defects in the developing fetus, and we do this by adding folic acid into prenatal vitamins. Neural tube defects, an example of that would be spina bifida. And so for mothers that are pregnant and do not have enough folic acid in their diet, they are at higher risk for neural tube defects in their baby. Another reason we would use folic acid is to treat megaloblastic anemia due to a folate deficiency. And also we can use it off-label to decrease the toxicity in some of the chemotherapy treatments that cause a deficiency in folate. There are sources in our food that we can use, like spinach, black-eyed peas, asparagus, and green leafy vegetables that help us to get folic acid or folate. However, beef liver is the highest source of folate, but how many people are eating beef liver? For that reason, to increase folic acid, the U.S. Food and Drug Administration, or the FDA, requires that all enriched grain products like our breads, our pasta, flour, cereals, grits, rice, all of that stuff has to be fortified with folic acid to increase the level of folic acid in the American diet and to decrease the incidence of birth defects due to folate deficiency. The deficiency itself, as a single vitamin deficiency, is pretty rare in the US, but when it does occur, it's usually from several nutritional deficiencies like folic acid deficiency or cyanocobalamin deficiency, which is B12. Both of these things are going to increase the risk for neurodamage and megaloblastic anemia. And we're going to round this out by talking about vitamin B12, cyanocobalamin, which comes in several forms. We have the endogenous B12, which presents primarily as cobalamin, and vitamin B12 supplements that are available as cyanocobalamin and hydroxycobalamin. With cyanocobalamin, it's the primary prep that we use here in the US. How does vitamin B12 work? Its action is involved in the carb and fat metabolism, and it's involved in protein synthesis. It's a factor of DNA and the formation of our blood cells, and this is why it is involved with anemia. We'll use it therapeutically for treatment of deficiency due to pregnancy or hemorrhagic or liver disease. When someone is pregnant, they actually need an increase of vitamin B12. When someone is hemorrhaging, they need an increase of vitamin B12, as well as liver disease. There should be an increase in B12 in the patient's diet. And the greatest sources of vitamin B12 are clams and liver. And so we don't really get too much of that in our diet, but we can also find it in other meats, fish, poultry, eggs, milk, and animal products. And just like the previous vitamin B9, it is also a component of fortified foods such as processed cereals. We do not get this vitamin from plants. The deficiency will result in megaloblastic anemia. So remembering that megaloblastic means large, we'll have macrocytic or large cell anemia. A deficiency in vitamin B12 can interfere with mitosis and lead to continued cell growth without any division. This is why we get those large cell anemias. Pernicious anemia is just an example of megaloblastic anemia. Also remembering that the autoimmune disorder can result in the loss of gastric parietal cells and produce intrinsic factor. So if we don't have intrinsic factor because we don't have gastric parietal cells, then we're not able to absorb the vitamin B12, no matter how much you take or how much you supplement. Other conditions that are worth discussing other than pernicious anemia are those like bariatric surgery, or if you have someone that has a very strict vegan diet, or you're just getting old and there's gastric atrophy. This is also going to result in vitamin B12 deficiency because you're not taking in enough or it's not being absorbed properly. These are going to result in this type of megaloblastic anemia. Vitamin B12 deficiency. The one thing that we are most worried about is neurologic damage, and this is going to commonly present as impaired mental status or cognition, mood alterations, and in severe cases, we might even see psychosis. Our patients will also experience peripheral sensory deficits like weakness, ataxia, and there may even be presentation of extrapyramidal symptoms. Now, because vitamin B12 deficiency will interfere with cellular replication, this is why you might get some GI effects like glossitis. This is the most common presenting symptom of megaloblastic anemia. Vitamin B12 has a very low potential for toxicity. However, it's something to be aware about. We didn't see any adverse effects in several studies, but it is worth discussing with your patient to make sure that they are not overusing vitamin B12 supplements. They are available in oral forms, but most times if you really truly need supplementation, oral forms are not going to help. For those that have inadequate intrinsic factor, remember, because you don't have enough gastric parietal cells to make intrinsic factor, which is going to absorb your vitamin B12 due to this autoimmune disease, or if you had surgery, then you might need more than just oral administration, and so therefore you would go into the parenteral IM injection. You can also find vitamin B12 as an intranasal spray or gel. Now these have an added advantage because they bypass the GI tract for absorption.